But over the past several years, we've had another crisis going on that has been claiming an average of 75 lives a month, which is, so much greater a death toll. And I'm speaking of the opioid crisis. Our current Attorney General used to be a lobbyist for the pharmaceutical companies that are kind of implicated in being the cause of the opioid crisis. And he's gone after some of the companies that he used to lobby and gotten some pretty small settlements, relatively speaking. So I'd like to know, if you're elected, is there anything you can do about going after some real compensation for the victims so that we have the money to set up what we need to deal with this ongoing opioid crisis?
Absolutely. And, this is a topic in every conversation that I have about the Attorney General's race, but you know what? I seldom have to bring it up because anyone I speak to about this office understands the gravity of the challenge you have voiced here. It's one of the central concerns for me in this office. It touches virtually every household now in West Virginia. And what do we know? The overdose rate has doubled in West Virginia during the time that Patrick Morrisey has been in this office. So whatever he's done, it has not begun to suffice. I'll tell you 3 primary points of emphasis in answering your question. First, we need to continue litigating against the responsible companies. And I am in touch with attorneys general around the country, who are doing that, who are coordinating across state lines to ensure real leverage for significant outcomes in these cases. And when I say significant, remember, we lose $8 billion each year to substance abuse, substance use disorder, and the addiction crisis in West Virginia. That's $8 billion with a B. So, $15 million judgment here or there, or a settlement, it's orders of magnitude off the mark. And we need to push for those billion-dollar remedies. Now, look, I can't sit here and promise you that I'm going to bring in $1 billion here and $1 billion there, but I can tell you that smart coordination, documentation of our losses, our damages, will help us to establish our equitable claims for recovering on the losses, the billion-dollar losses that our state has suffered. So we have to push litigation, and part and parcel to effective litigation is effective data and effective documentation. So we have to do better on that front, pushing for outcomes in litigation. That's the first point of emphasis. And there's an important data component that relates to that effort. I think we've fallen short on tracking the metrics that will enable us to argue more forcefully for better recoveries in court. So I handle class action litigation in my law practice, and I understand the kind of coordinated advocacy that we need to bring on that front. That's point number 1. Point number 2, the federal Medicaid dollars are some of the most significant support that we have for addiction treatment in West Virginia. And when Morrisey is out there attacking Medicaid expansion, we have to remind our healthcare community and our public, our neighbors here, that he is attacking the backbone, the financial backbone of the addiction treatment delivery system in West Virginia. So the prior question about healthcare and health insurance really also affects and implicates the opioid crisis and the addiction crisis, because if Morrisey succeeds in attacking those federal healthcare dollars, he's cutting us off at the ankles in our fight against the addiction crisis. Most every treatment provider that's out there in West Virginia helping us to make our way through to this crisis has benefited from the Medicaid program. It's a backbone payer for the clinics and the treatment facilities. So that's the second point. Stop the attack on the federal treatment dollars that are helping us. Better efforts on litigation. Number 2, protect the federal healthcare dollars that support addiction treatment and recovery. And then point number three is really near and dear to me here, which is something I've written about and tried to educate my fellow lawyers around West Virginia through teaching classes on the topic, in recent years. And this is my third point of emphasis. Substance use disorder is a disease. It requires medical support and accommodation, just like any other disease, diabetes or epilepsy or COPD. West Virginia has a human rights law that ensures that we provide support to people with these kinds of diseases in our state. And it's the Attorney General's job to enforce that Human Rights Act, to enforce the support for people with diseases just like substance use disorder. So what does it mean for the Attorney General's work? It means that we need to see our Attorney General advocating to help people with substance use disorder. If they've gotten clean, if they're sober, they deserve support getting back in the workforce and back with their families. We know that all the studies in the Substance Abuse and Mental Health Services Administration at the federal level has told us over and over again, the two biggest barriers to success with long-term recovery are stigma and unaffordability of treatment. So if we treat substance use disorder like the disease that it is, and we ensure support for people getting back into the workforce and back with their families, the evidence indicates that we will start to see better outcomes and God willing, a reduction in the overdose rate. So that's the third point of emphasis. Use our human rights laws through the Attorney General's office to really meaningfully support people in long-term recovery.
Well, that's a great and very detailed answer, and I appreciate all three of those points.